And Tiffany asks, I know you've been working with practices for nearly a decade to report MIPS and PQRS. What have practices found to be the biggest challenges using eCQMs from their EMR to report quality?
Thanks, Tiffany. Great question. I think the main problem with eCQMs is the rigidity of the process. Second problem, I think, is expense. It tends to be an expensive way to go. Of course, that's highly dependent on the specific EMR and their pricing policies. For the eCQM process. So on the subject of rigidity, it starts with a limited choice of measures compared to around 170 MIPS menu MIPS CQMs. Measures. There's, I think, 48 eCQMs, and most EHRs are selective about which of those 48 uh, they support, and they're not required to support all of them. And few do. On the registry side for MIPS CQMs, Medicare is fairly heavy-handed pushing registries, and most like us do all measures, all methods. So there's much more flexibility in your choice of measures. Um, in producing eCQMs, you can do that through a single EHR vendor that's providing the EHR, or it can be a multiple process with multiple vendors involved in getting the data from the documentation in EHR to a submission to Medicare. And every step of the way, those vendors have to be certified or the process is not ultimately acceptable to Medicare. And certification is not so much about the right answer as the right processes to prove that you, to some degree, that you have the right process in place. Yet I've seen a number of failures of output, even though the certification is solid. Um, uh, Whereas on the qualified registry side, qualification is about outcome. So the difference, the certification for eCQM vendors compared to qualification for registry vendors is kind of like the difference between process measures and outcome measures. Um, on the certification side, it's really certifying that your knowledge and possession of the right processes, but doesn't really as easily translate to the outcome being proper. On the qualified registry side, Medicare stays pretty much out of the process. And really certifies on the outcome with an annual qualification involves recertifying the or attesting to the existence of the processes, and when it comes down to proof to Medicare, it's all about looking at the output and making sure it's proper. It works. The eCQMs work if you have strong documentation standards and compliance with those documentation standards, and that's a big requirement. When was the last time you had a group of doctors agreeing on the best way to document anything? That can be that's still a very big challenge. Next is stability in the specifications. Measure specifications change. Medicare tends to be a little more reliable or stable in the eCQM specifications than in the MIPS CQM specifications, but still, most qualified registries can turn on a dime. And when Medicare says one day that as of tomorrow you have to change this logic, most of us can generally rise to that challenge. Whereas for eCQMs, when it's hard coded into your EHR, it takes on the average 2 years for an EHR to take a good new idea or a requirement and code it into the product, and another 2 years typically to get it out to their their clientele. So that's certainly a threat as things change. Typically, if all those things are working well, you can typically count on a good push button uh, set of metrics that you can get out to Medicare on time. But that even in that case, it's typically reliability is limited to a single instance of a single EHR. And once you start trying to take a community that exists, say in an ACO or even in a growing community health network, um, uh, the barriers increase geometrically as you add organizations and different EHRs and different implementations of the same EHR. So it can become prohibitively expensive if it's even possible to pull that data together. So that's my view. Certainly, the comments that people have come to me, the things I've seen as I've been watching discussions in the listservs and in meetings and with potential clients and existing clients. So thanks, Tiffany, for the great question.